prior to coming to Australia and resettling my family here, I'm a medical profession by background. I had that naive thinking that, okay, I'll be able to find my way around Australia, know the health system, the health sector. I found out, no, it was the other way around. I need to do a lot more work in navigating, finding my way through where to go, where the services are, and what's available out there for me.
I think it's really important for us, because even though I may know a little, but I still have to learn a lot as we come into a new country and so many new systems that we're never familiar with before.
As someone that has been in Australia for nearly 19 years, most of my life, I didn't know the health system very well.
The Walk Through Health program is a community health program that is run by Wyndham Community and Education Centre in partnership with Mercy Health. This program aims to work with people from new and emerging communities who live in the city of Wyndham to learn more about the health system. The health system in Australia and Victoria can be quite complex and confusing for people to navigate, particularly people who are from migrant, refugee, humanitarian entrant backgrounds when they first come to this country, or even if they've been living here a while. So the Walk Through Health project was really providing an opportunity for people to meet with health services and professionals, to learn more about the system, and even to engage with those people to provide feedback on what can benefit them with engaging with services. We know that people from migrant and refugee backgrounds may miss out on health and wellness supports because of the many barriers they face. In particular, language barriers, cultural barriers, as well as financial pressures they may have, as well as just the lack of knowledge or the lack of trust with services. And this really impacts on the way that they can navigate the system and access the health and wellness supports that they need for themselves and for their families.
I think with the health system, we face a lot of miscommunication, misunderstanding, or just in general we don't get access to this kind of information due to our language barriers, due to us also just going off by word of who we know. So if it's just one GP, we all go to one GP. We don't know what other services are out there.
In refugee camp, we don't have any proper healthcare system, so that even though when we're trying to go to the hospital or the clinic, we don't have much knowledge of how to approach to the medic or the doctor.
The program worked by inviting community leaders and bicultural workers to weekly sessions to meet with health professionals from different health services in the city of Wyndham. The topics that we covered included visiting the GP, visiting community health nurse, going to the emergency department, as well as other topics that people hadn't heard of before, like consumer advocacy and the Health Independence Program.
Werribee Mercy Hospital is situated in the city of Wyndham, and we know that it is one of the most culturally diverse parts of Australia. At Werribee Mercy, our patients come from more than 200 countries of birth. They speak more than 170 languages, and they follow more than 80 different religions and faiths. So it is a world in a small locality. In terms of our services, we do everything from maternity and babies all the way along that continuum to, the palliative care and kind of end-of-life issues. So multicultural services at Mercy Health are responsible for ensuring that our organisation develops strategies to ensure we provide culturally appropriate care. Part of that is providing interpreting services to our patients, but also thinking about a range of other strategic ways in which we can do that. Training our staff on delivering culturally sensitive care is another significant component of our work as well. But something we all love to do is the community engagement, and which was part of this Walk Through Health project. In the Walk Through Health program, we try to improve health literacy of our participants in order for them to be able to take that information to their own communities and to share it with them, and hopefully through that process, improve the health literacy of the broader communities. We know that health literacy impacts everyone, anyway, in the society, but we know that migrants and refugees are more likely to have low health literacy when it comes to Australian system in particular.
This is the first step for me to learn about one of the very important areas that I must learn about while living in Australia. And so therefore coming in and joining the program opened my eyes to a lot of things.
Being a migrant myself, where I come from, there is no way to complain about a health service. There is, nobody talks about healthcare rights necessarily. So we find that that was a significant thing in our program to highlight to the participants that there is an Australian Charter of Healthcare Rights, and sometimes people are not aware of it. So we made sure our participants knew that and understood what rights they have when accessing health services. We also talked about the system of providing feedback, compliments, complaints and suggestions, because again we know culturally that is not something that people would think of or think it is appropriate. So unpacking that, there is no retribution if you actually give a health service negative feedback, but in actual fact we would use that to improve our services and to make sure that it doesn't happen again to another person. And really having fascinating conversations with our participants around those challenges and the level of comfort and discomfort in terms of providing that feedback. For us at Mercy Health, we are fortunate to have a small but a lovely team of people that can assist non-English speaking consumers in particular through that process by providing them with interpreters, scheduling times, translating their complaints if needed, and those kinds of things, which is a small step in trying to assist them to feel more comfortable to share their experiences.
Yeah, the consumer rights information was really stood out for us because, the background we came from, we never had the rights to stand up and for ourselves. We always have to agree to someone's opinions and follow people, But in here, we know that we also have our rights to refuse or to ask for information. So this is really helpful.
I work at Werribee Emergency Department. We see a variety of people from all different cultural backgrounds and ethnicities from all different age groups. When they present to our emergency department, it could be something simple or they might need overnight care. People who come to our emergency departments come from a variety of different multicultural backgrounds. We aim to meet their needs and provide them the best care we can. We do this by giving them access to our on-site interpreter service. If they come through after hours, there is also an after-hours interpreter service available for them to use as well. It's really important for everyone to understand the process of triage. Triage is a vital process that everyone who presents through the emergency department will go through. When patients present, they will get triaged with the categories ranging from 1 to 5. 1 meaning that they need to be seen most urgently by one of our medical doctors, and 5 meaning that they can wait to be seen. Some people might not understand, whilst waiting in the waiting room, that people will get brought ahead of them. This means that they will need to be seen by a medical doctor more urgently than them. This makes sure that everyone remains safe and we see the patients that need urgent care more quickly. Recently, we have introduced the red flag system. This is a card that lets parents flag areas of concern. If they believe that something is not quite right with their child and they want to escalate their care, they can initiate the red card, and a staff member will be able to come over and reassess their child. Our red card system is available in multiple languages for our multicultural community. It's really important for our emergency department to be involved in the community education programs. Everyone in our community needs to know how to access our service so we can provide care for everyone.
Honestly, every topic is really interesting in, particularly in their part. But I think for me is that, the emergency, how to access into the emergency department, because we don't know before that if we need something, we go to emergency and then we could get into emergency straight away. But then now we know that there is a lot of way. There is triage, and then if our case is maybe less stressed, and then they can, we still have to wait.
So the Health Independence Program is a program that supports people who may have just left hospital. It's based in the community, so I suppose it's more of an outpatients type program. It has 5 different services attached to the program, and one of the key ones would be community-based rehabilitation. So that's supporting people who may have just come out of hospital and are quite weak, or who have perhaps a progressive issue going on where they need some support. They might need physiotherapy or occupational therapy to regain some of their strength, or they might come in and say, I used to be able to garden, or I used to be able to play with my grandchildren, and I can't do that anymore because of changes to my health. So we have a real rehab focus. We also support people who have chronic diseases, so we call that complex care, and that's really supporting people who are struggling to manage changes in their health, or who perhaps even have a number of different issues, could be with their heart or with their lungs, and they need some education, or they're finding it really difficult to navigate their way through the health system, which is a challenge a lot of people face. So our job is to help coordinate that, work with them, and ensure that they're getting the right supports. Another really important program that we offer is a continence clinic. And I say that's really important because I think continence issues are a little bit taboo or stigmatised for many people. There's often quite a lot of shame attached to it. So what we find is that we're getting a lot of referrals for people, men and women, who are struggling with urine incontinence or bowel incontinence, or who come to us for a different problem, and then as they get to know us and we assess them, they then disclose that they're really struggling with toileting. So we have a fabulous continence nurse and a physio as well. We have a falls and balance clinic too, and we often see a lot of older people who are struggling with changes to their balance, or who might have fallen and broken their hip and are quite fearful, and that makes them more at risk of falling. Sometimes we see people with changes to their memory or other cognitive changes that also means that they're more at risk of falling. So we have fantastic physio and OT who work in that program. And finally, we have a residential in-reach program, and that's one of our nurses who goes into nursing homes and supports people in those nursing homes who might be at risk of coming into hospital, and he works with the workers and the nurses there to ensure that they have good nursing support. I think one of the issues that's particularly relevant for women is that we see a lot of women who are in a carer role. So they may not be our client, but what we like to do is we not only have contact with our clients, we also ensure that we have contact with families of clients. So we introduce ourselves because we acknowledge that the client themselves is often being supported by a carer. That caring role does often fall to women. So I like to introduce myself to the carer and to say, hey, how are you? How are you going? What's happening in your role? What kind of care are you giving? And how are you finding that? Because we find that a lot of women sometimes women can neglect their own health, or don't even have time to think about their own needs, their emotional needs, their physical needs. And sometimes that can start to weigh really heavily, can start to feel like a bit of a burden.
So the Health Independence Program stood out for me And I think even the coordinator who did that session touched on subjects or issues that resonate with me. I'm from a community where we're very relational, we're all communal. It's not a me or I sort of language, it's we or our way of doing. The H.I.P program allowed me to think, okay, so there is a service in place that can actually support me from getting from point A to B to C and help me through navigate that, because it's, like I said, it's a very complex system and it can be very overwhelming.
So Utopia is a general practice and primary care clinic, and we do also provide some specialist and allied health services to anyone from a refugee or refugee-like background, and that includes asylum seekers in Wyndham. I'm a GP, and so I work across the lifespan with patients from birth all the way into older age, and it's a really lovely role because I get to meet people and look after not only them but their family members and follow them through with their health and their health journey, support them through crises or questions around health, and also get to kind of coordinate some of that care that needs to be done within the Wyndham community and within our specialist services as well. We work with a really vulnerable population here at Utopia. All of our patients are from a refugee background, and they're often new immigrants who are finding their feet. They're often survivors of incredible hardship and trauma, and what we want to see is we want to see them thriving and growing and settling and looking after their health and well-being as they become part of the Australian community. I guess the thing that I would say at Utopia that we've really tried to do is to think about what makes this service accessible and how can we design a service that is accessible for the most vulnerable person in our community. And that means that if they don't speak English, we hold space for them. We use an interpreter. If they perhaps have a lot of trouble getting here, we have bicultural workers that try and support them with those needs. We have lots of linkages with community groups around us, you know, social workers, allied health, people both in the hospital system but also from council, from other community organisations. We've really tried to strengthen those linkages. I don't think it's unfair to say that women across all societies hold up more than half of the world. And why is it important for women to get good healthcare? Well, in and of themselves, women are people and they deserve to be looked after and to have good care and to be cared for. I guess the second thing I would say is that if we don't look after women, it has wide-ranging ramifications for the rest of society. And that's a secondary thing because women deserve care. But if we say often, if you educate a woman, you educate a community. It's the same with healthcare. If you look after a woman, if you support her with her well-being, her mental health, her physical health, you are supporting the well-being. There are ripple effects for families and communities.
So IPC Health is a community health organisation and we work across the western suburbs. We have many different campuses. We offer a wide range of different services. We have medical and dental, we have allied health, we have refugee health teams, family services and a whole range of other services for people. Our client group is diverse. We see many people from the community, people who have cultural and language diversity, people from First Nations communities, persons from the LGBTIQA+ community, young people, international students, a whole wide range of different people in our community. An added benefit of coming to see a youth and women's health nurse is that our service is free. and you don't need a Medicare card to access us. The reason that women may choose to come and see our service is we offer extended consultations of up to 90 minutes. We use face-to-face interpreters in the client's language. We're all women, so we are very experienced in talking about women's health issues. We are family friendly, so if you have to bring your children, that's okay. And women talk about a variety of different topics. It can be planning or preventing a pregnancy, sexual health, government cancer screening that they may not be aware about, so breast, bowel and cervical screening.
The topics that I found really interesting was presented by the IPC community nurses. It was good to get information such as being able to have access to breast screening for free and also the pap smears. I found this is crucial information that I can pass on to my community without them having to stress about cost and accessing these services on their own.
My name is H.I.P. I'm a settlement worker at the Wyndham Community Education Center, and I am the member of a current community. In 2019, I did some training with the Cancer Council of Victoria about the cultural awareness of a cervical screening test and also bowel cancer, so I can pass the information to the communities. A lot of the women in my community, they are not aware of the services. They may also have a language barrier, they may also shy, and they may not know that this service exists. They also taught me how to book appointment for the community to attend the cervical screening test, and also how to do the test correctly, and to share the information about the screenings and also answer the questions from the community when they have a question. Now I can see many women that they book their appointments to attend cervical tests at the IPC Health or at the Utopia Clinic.
The program was of benefit to community members because it enabled them to learn relevant information for their health needs and then take that back to their families and their communities and the groups that they work with to share that information. And from there, it has the ripple effect of moving out into the community and getting people to engage with the health services, and also hoping that the health services will also respond to their needs as well.
I got a lot of experience from this program, and especially because we came from a less knowledge background, so we learned a lot from the program. And then as a women group, we go back to the church community and then we share our knowledge to those less advantaged people.
Since the program, it's one program I reference a lot when I do talks, even if I'm sitting in a community organization. I've also sort of took it upon myself that since I now know this information, I realize that if I'm struggling, despite the fact that I have this medical background, if I'm struggling, then imagine the rest of my community who have been here for so many years.
I'd really like to see projects like these be instrumental in connecting community with services and also helping to prompt us to think about how we design healthcare for people with low literacy, for people who might speak English as a second or third or fourth language, for women and other genders, for the most vulnerable, for people who are living in on the poverty line. I think if we can create a health system that looks after all of those people, we make a better, more just, more caring and healthier society right from the get-go.
I think from this experience, what I've gotten out the most is that there's so much to learn about the health system. Like I said before, I've been here most of my life. And I still don't know these things. I still don't know I have access to these kind of supports that, you know, we all can benefit from. And it's something that we should all be able to access. And it's a shame that language barriers or not having the connections limits us from these services. So I've overall gained a wealth of knowledge, and I hope that the people I do pass it on take it up, and they're able to continue passing it on to other members of my community.